Alrighty, welcome everyone. Happy Friday. Today is match day, so there's a lot of happy people that you see all over. And it's also 2 days before St. Patrick's Day. So y'all have a safe weekend, I guess you could say. We're gonna get started with our short little introductory video, and then we will let our speakers take it away.
Hello everyone and welcome to today's session. We are PreMedCC, a student-led organization established in the fall of 2021.
I think the sound went out, at least for me.
Sound's not working?
Parts about our events is that they're virtual, so you can do it from the comfort of your own home. We typically have events on Fridays from 5 p.m. to 6 p.m. PST, and on Saturdays from 10 a.m. to 11:30 a.m. PST.
If you aren't able to attend the event, all our sessions are uploaded on our YouTube channel. Many of our sessions will end with Q&A with our speakers. Any questions that you have can be put in the Q&A section on Zoom, and our team members will read them and have them answered.
After you have attended our event, you can log on to our website and complete the quiz, which will contain questions pertaining to our session today.
If you score 70% or higher on the quiz, you'll be awarded a 2-hour mentorship certificate to show that you attended our session today.
If you want to stay connected with our upcoming events or want to tell your pre-med friends about PreMedCC, you can find us on Facebook, YouTube, Instagram, and TikTok at PreMedCC.
All right, hello everyone, and welcome to the first collaborative event between the National Student Medical Association and PreMedCC. This webinar was created to explore the challenges and obstacles faced by aspiring healthcare professionals as a result of racism and discrimination that we know is prevalent in academic and healthcare fields. The National MAPS Committee has reached out to our SNMA alumni expert speakers who will provide valuable insights and strategies and resources to help us, the audience, effectively approach these systemic barriers. We hope it will be an opportunity where all of our audience tonight can gain some valuable insights and empower yourself to create positive change in the healthcare field as you go throughout your journey. My name is Logan Dean, and I am the current pre-medical board member and the chair of the National MAPS Committee, a part of the Student National Medical Association, and I will be the moderator today. We are excited to have our speakers this afternoon on the West Coast, this evening on the East Coast, and I will take a few minutes just to introduce our speakers. First, I do want to say that Dr. Kulalani will not be here tonight because he did fall sick earlier this week, but we do hope he feels better soon. And with that said, I'm going to introduce our two speakers that we do have here tonight. I'm happy to introduce Dr. Tatum. Dr. Tatum is a physician and educator who focuses on promoting justice, equity, diversity, and inclusion in medicine and mental health and primary care. She is currently an assistant professor at Eastern Virginia Medical School, where she serves as the medical director of mental health pediatrics, vice chair of diversity for Department of Pediatrics, and the associate program director for the pediatric residency program. Dr. Tatum has been invited to present and lead workshops nationally and internationally promoting justice, equity, diversity, and inclusion in the healthcare environment. So thank you, and please give a warm welcome to Dr. Tatum. Next, we have Dr. Omorui. Dr. Omorui is currently a professor in the Division of Community and General Pediatrics at the John P. and Catherine G. McGovern Medical School, associated with the University of Texas Health Science Center at Houston. She completed her undergraduate degree at Duke University and is a graduate of the Duke University Medical School. She's obtained her master's in public health from the University of North Carolina Gilling School of Global Public Health. And after finishing her pediatric residency and chief residency at the UT Health at Houston, she's joined the faculty and currently serves as the program director. Thank you both for being here tonight. We're going to start off with a few questions, if that's all right with you all. And I'm trying not to cut off my face. So the first question we have is, how do you perceive the rollback of affirmative action policies affecting diversity inclusion efforts in higher education, and specifically as it pertains to those who are trying to go into medical school or other health associated fields? Oh, sorry. I guess we could start with Dr. Tatum.
I was going to start with her anyway.
Yeah, I think we're already starting to see some of the effects with match going on right now, just finishing up this week. A lot of states who have a lot of that anti-DEI legislation have seen a decrease in the number of applicants that are applying in those states, because people are really concerned about how will this affect me? Not only how will it affect my career, but my livelihood, how will it affect my education? How supported will I be? And I think that's something that we really have to think about. I know a lot of our national organizations are starting to do studies looking into the effect that it's had so that we can see numbers, number one, but also what do programs and I'm speaking of programs in particular because it's hurting programs as well as the trainees, but what do programs need for support? I think one of the things that we're going to see, one of the trends we're going to see is that we're not going to see the word diversity used very often. People are going to find other ways to say that they are looking for a heterogeneous, I think that's a good way to say it, a heterogeneous group of people to work with, but we're going to see a decrease in the words used with diversity and inclusion. You may hear more about health equity because equity has not been banned as much as diversity and inclusion has, but by saying that this is a health equity issue, then I think those will be keywords to look for. But overall, we really don't know yet. And I think that it is really going to be an area that people are going to really have to be creative about and making sure that we're still pursuing it. What I can tell you is that programs nationally are not using the words, but they're still trying to make sure that they recruit diverse classes, diverse medical students, diverse residents and trainees. And so that's still occurring. It's just not being advertised the way that it was previously.
Yeah, just as Dr. Tatum said, we have just finished the residency recruitment season. And as somebody who conducted a lot of interviews and was part of the recruitment process, of course, as a program director, I did feel the sting of, so you're in this certain state, how are you all dealing with that? And similar to how she stated, I'm labeling it a little differently is what I've been telling most of the applicants, but certainly my heart and our program's mission is around promoting and recruiting and retaining and supporting trainees who reflect the diversity of the city that I work and live in. And so, yes, I think there's a little bit of an additional barrier for this work that's already hard, but people are still passionate about it. People still understand the importance of it. There's research that echoes that as well. And thankfully, many of our accrediting bodies obviously also are still understanding the importance of it. And so they're providing the backing, even if sometimes the state legislation has made it a little bit more challenging.
Thank you both for that. I think that has been the sentiment that I've heard as a current pre-medical student, and also from medical students who are looking to match into residency, and is a valid concern, and is also correlated with the reduction, I guess is a good way, of the DEI offices at our institutions. And so my next question is, I'm not sure if it was known from the student perspective, what the initial goal of DEI offices were. If y'all could share that. And then, with that initial goal, what have we now, or some institutions has now lost with the loss of our DEI offices?
So I think it depends on where you come from. If you were in a program that had DEI offices prior to 2020, you're already pretty good because those principles were already established and it wasn't something that was done that was reflective. You know what I mean? It wasn't in response to, oh, everybody else has it. Your institution already had that as a part of their goals, their mission, their vision. And so that's different. Even if their state legislation says that you can't have this DEI offices, they still hold those principles. For some of the programs that they created, oh, we have to do all of these positions after 2020, I was a little hesitant about those programs anyway, because they were doing it. I'm sorry. I'm not sorry. I'm really honest, but they were doing it as a way of saying, oh, we do care about this, when they actually didn't. And so it's even more so seen when they were so quick to close these offices. And so I would say that, again, look at the history, look at when those offices were formed, look at when those officers were hired, and if they had to get rid of them, that time frame. I think that makes a big difference. The goal is for recruitment and retention as well as support, because we know that, as I'm looking at this screen, I have 3 Black women on the screen. Medicine was not created for people who look like us. And so even for me going through, it was difficult. It was hard in every step of the way. And I didn't have, until the 4th year of medical school for me, I didn't have anyone that looked like me to support me. And that was really difficult. And so those offices were created so that people who don't look like the typical physician and what, the standard physician looks like would be able to feel supported and feel that sense of belonging, and know that if I have those instances where I feel like I'm alone, at least I know there's one person or one office or one place I can go to where people get it and I can find support.
And for me, I went to an institution that had a medical school that had a DEI office way before a lot of other ones did. And that's exactly what it was. It was a place where I could rest my head and be myself. And I credit that office for getting me through medical school, because it was very challenging for me. And I still am, 13 plus years later, very much still in contact with those people, because they were certainly a huge sense of support for me.
The only thing that I would add is those DEI offices have one thing that's really important more than anything else. It's a budget, like being able to provide resources, like, hey, you want to go to a conference, hey, you want a research stipendship, hey, you need extra tutoring. So I mean, I think that's the whole point of DI, is that there's extra support for people that are disadvantaged. And like, Dr. Tatum said, like, y'all have gone through school from undergrad to medical school to you are the only people in the room that look like you. And I mean, not even like, let alone classmates, but leadership as well. I mean, so I think that's kind of the important thing, is that I personally think that it's the resources that they have available to students, and also, provide support that where it's needed. Um, so yeah.
Yeah, actually, my next question kind of builds off of that. And for the students who are experiencing closures of their DEI offices, what other like offices that are like, general typical to most institutions, can they seek support from instead, especially in the aspect of like funding for conferences, or connections to research experience, or, other ways that folks were using DEI offices?
I feel like there's a question I almost want to throw back to y'all, because I would be curious what you all are doing. But I think if I was a student now and I'm trying to like put myself in that position, it's understanding that y'all have a network that doesn't just, it's not limited by the walls of your institution. Like events like this are, I would say, resources to you. And then so it's important that y'all share that with each other and tap into those networks. Because it may be that, Logan, you're telling somebody else at another school, this is what you did, and then they can then use that to in the same way. But I'm gonna let Dr. Tatum, if she's got any other ideas.
Yeah, I think you all have a tool that we didn't have called social media. We didn't have that back. I feel like the attendings that I
How
used to
was it
roll my
that
eyes at,
MySpace wasn't popping back then, y'all?
not for medical
No,
school,
Logan, no, you don't
absolutely
do that to us. MySpace.
don't do that. She threw MySpace at us.
What is MySpace?
Oh, Jubin.
Exactly. I feel like those attendings I used to roll my eyes at that would be like back in my day. And now I'm saying back in my day. But we really did not have
Use
the
smoke
benefits of
signals
social
or
media. And so, looking at Instagram, Twitter, let me tell y'all, Twitter is a huge source of support for medical students, pre-med students, faculty. I have seen so many people find support, or even people find mentors, find positions that were open from Twitter. So I would say lean into, as Dr. Amarui said, you don't just have to find the people at your school. There are people all over that are willing to help you. I've had so many people reach out to me on Twitter, say, can I just talk to you about my situation? Can you give me advice? I'm like, yes. Or other people that have sent people my way. And I'm like, I don't even know how did you get my number, my email address? I don't know. But yes, baby, I'll help you. That's what we do. We look out for each other. So don't be afraid if you see someone in an event like this or any other events that are being held virtually and they say, here's my email address, use it. If we give it to you, then that means we're willing to help you. Now, we may not respond right away. I'm going to be totally honest. So give us some grace there, but we will respond and we're there. And if we're not the person that can help you, one thing that, as when we first got on this call, Logan was like, you all know each other? Yes, we do. We know other people. And so if I can't help you, I'm going to find somebody that can, and I'm going to send you that way. So I would say lean into the social media aspect of it, lean into people that you meet or see. If you come across a physician that looks like you and you see their profile, send them a DM, pop into the DMs. Ain't that what they say? Pop into the DMs and slide on up in there and say, hey, can you help me? I'm having some problems finding this is a solution to my problem. So go and slide on up in the DMs.
And first of all, I've really enjoyed the conversation. It might not come out clearly in this event, but I am very much an introvert. And if I was to go back in time and do this whole pre-med journey over, I would have asked for help and earlier. And so exactly what she says, if I'm giving you my email, I'm giving you my cell phone, and I'm saying, reach out to me, I really, truly mean it. We are busy people, but we understand that really advisors, mentors, sponsors are really the keys through getting through this process as smoothly as possible. And so we do want to support you all. We want more people who look like us in medicine.
Can I just add something? Is somebody who emails a lot of people, like understand they're busy and also email them, but also understand that they're your mentors and not your peers. So how you approach them is very different. We actually had a speaker last week that talked about that. It's very different. First of all, if a physician gives you their cell phone, it's like when it's a life situation to contact them. Don't text them at 2 in the morning. But also how you address them. It's Dr. Tatum or Dr. ONU, or it's professionalism. And I think that's something that you have to be really careful, because they're very busy people and they've got 7 different things to do, and they're doing you a favor. So having that respect is really important, but also not being afraid to follow up with them. Like if you don't hear back from someone in a week, just send them a courteous email. Just don't say, hey, I've been emailing you, why don't you answer me, or something like that. And now, like with emails and stuff, you get reminders if you don't get responses. So yeah, just being courteous and being appreciative and thankful. But I think that professionalism, I think sometimes go out the door, and I've heard some people say that, hey, so and so approached me, but just rubbed me the wrong way or things like that. And you have to be careful. Even though they want to help you, they're not your peers. It's not like you could, text them at night and say, hey, I have this issue or whatever. So yeah.
And I agree with that. So I'll give you an example. I met Dr. Omari when I was a resident and she was a mentor when we first met. She's still a mentor, but we have transitioned from that mentor-mentee relationship to the point where I can text her now because we're friends. And so in the beginning, when I first met her, I think for like the first 3 years, I only talked to her when I saw her at conferences. I would be so excited because I am too an introvert, even though it doesn't seem like it. But I would be like, hi. And then finally, I got to the point where I felt like we gotten past that. And I could call her, email her, or text her when I had questions outside of the conferences, and I didn't have to wait a whole year to see her and ask all the questions. So that is important, to respect whoever that person is that's your mentor, but understand that that relationship can change, and very often it does. And they will still be your mentors, but you can't, now I can call her by her first name, but back then I would never. So yes, thank you for bringing that up, Juven.
Yes, I think that's super important. I am currently a high school teacher in the communication. Woo, we working on it. So we are working on it. But
You're doing the Lord's work.
Say it again. Yes. It's a lot. But I think that, well, I know that it translates, into college, that communication piece, and the way you would email your professors is the way I would email a prospective mentor who is trying to help me get through the pre-med journey. So that is definitely an important piece to mention. Sorry. And oh, now I kind of want to speak about experiences in the academia space, and ask and ask how do you think, or how or if you know of any experiences of how racism or discrimination has shown up. It can be either in our audience today is mainly uh community college students, but we also have 4-year degree undergrad students. We may even have some graduate students here on the call. How does that show up in that space, and how do you address it appropriately? I know this might take like might take like a
for me, okay, I didn't have the language before, so I don't know if I think now that I can reflect back, I can think about, it was the compounding microaggressions that I experienced during that time. So I have a challenging last name, and people who wouldn't bother to try to learn it correctly, or would make fun before they would try to say it. The ones questioning that I was pre-med. So there's a lot of things that I think would probably just send me down a rabbit hole if I started listing them out, but it's definitely, if I can reflect back, it was compounding microaggressions that really then hit to my, what they say call now stereotype threat. Like, am I supposed to even be in this space? People keep questioning me seeking this pathway. Why am I seeking it? That awful rabbit wheel, or hamster wheel, excuse me, that was going on in my head.
Yeah, that's a tough one because I've seen it all, from the overt discrimination to people call microaggressions micro. There is nothing micro about them. They do not feel that way at all. They feel major, they feel macro, and they continue to follow you throughout your career, and you continue to think about them. And not only does it cause that stereotype threat, but it also causes us to have imposter syndrome when we know good and well we worked our butts off to get here, and I deserve to get here, to be here, just like the person standing beside me. I had, and I'll just give you a couple of examples. When I was in the 7th grade, I told my guidance counselor I wanted to be a pediatrician. And he said, "Oh no, a young Black girl like you shouldn't try so hard. You should try to be a nurse so that when you fail, it won't hurt so bad." I said, "What?" I went home, I told my mama, I told my grandma. I won't even tell you what my mama said to him. But to me, my mom and my grandmother told me two things that I have carried along with me throughout my career. One, my mom told me to ignore the ignorance. That man is straight up ignorant, and he has no business saying that to you, so ignore it. My grandmother told me, let your haters be your motivators. All of those people that are telling you that you can't do it, you shouldn't be here, you won't make it, you just use those as what was the movie, Waterboy? But he was like tackling fuel. That's tackling fuel for you, so that when you get there, you don't even have to say it. And I'll give you an example. That same man that told me I couldn't be a physician, Logan, I was a high school teacher too. I went back to my old high school to teach, to show the kids that grew up like me that you can do whatever it is you want to do no matter what they told you. And I went back to the middle school that was across the hall, and I walked in and I was like, "Hi, yes, I'm a teacher now." And he just looked at me because he didn't even think I would get into college. But I did. And even for the people who said that I would never be a pediatrician, the people in medical school, the people in undergrad, I went back to those places too and just, hi, I just showed up. They were my motivators. And I had to let them know that your ignorance didn't stop me. And so you're going to see that, you can see that throughout. People think, oh, it's 2024, it doesn't happen. It still does. People still ask, oh, how did you get here? You hear that, and they call that a microaggression. You may hear people doubting you. And I'll tell you, for women, you don't speak up loudly enough. Oh, they'll say you're not confident, you don't have leadership skills. We are great leaders. I may not speak up every time because y'all really don't want to hear the thoughts in my head all the time. But I still deserve to be in that room. And so you will hear the overt ones, you will hear the micro ones. And one thing I want to tell y'all, don't gaslight yourself. Yes, you heard what they said. Very often we will sit there and say, I don't think I just heard what I heard. You heard it. You heard it. It happened. They said it. Don't gaslight yourself, even though they're trying to gaslight you. Know that this is what they said. This is how that person thinks about me. I know I can't go to them if I'm in trouble. Keep track in your mind mentally of who those people are that told you these things, because they're not going to be the ones to help you. And the other thing I want y'all to realize is that the discrimination and the racism can come from people who look like you. Don't think that just because they look like you, they're going to automatically have your back, because they will not. And I'm going to stop there.
She went there,
Dr.
but
I can keep going on another time.
She did go there. And I think that's exactly, unfortunately, like pre-health, there are wonderful people, but there are also people who fit the stereotype of the pre-med that we see on television. And they can look like you. So just be mindful of that.
And half of the pre-med advisors, they wanted to go to medical school but couldn't get in. So let's just be real. Do you really? Yes, I went there. I said it. I know this recorded. Sorry.
I think I got y'all fired up. So that's good, because we have a question from the audience. The question says, how do you overcome or deal with stereotype threat and imposter syndrome? Sorry.
Because Dr. Tatum, I love her quip, so I just want to be able to listen to her. So I'm going to start off and say, for me, it was finding the supportive space. And so whether it be maps or something similar where people look like you, or maybe they don't look like you, but they're supportive of you. I think that truly has been the key for me, even as I continue to progress in my career, to have wonderful people and peers like Dr. Tatum that can help me say, no, what you experienced was real, but then this is how we can mitigate that.
First thing I'm gonna say is get a therapist, because I think too many of us feel like we don't need the help. to get through those things. And if you find that a lot of times the things that you've been through are constantly going on and on in your head, get a therapist to help you deal with it. I did, I still do. I see my therapist regularly. There is nothing wrong with that. Number two, give yourself a chance to feel however you give yourself permission to feel however it is that you feel in that moment. Because too often we're told to, oh, push it away, don't feel that way. Again, people start gaslighting you. They tell you, we gaslight ourselves, but give yourself permission to feel whatever it is that you feel. The next thing I want you to do is think about all the things that you have already overcome, because you have been through. If you have not been through anything that's tough in life, then that means you haven't tried hard enough. And I really don't know if this is for you, because it's going to be hard. So think about the things that you've already overcome. And then once you do that, know that you can push forward. And as Dr. Omarui said, find your team. She is on my team. When I'm starting to feel like she has been since I met her, when I'm starting to feel like, I don't know if I can do this. I don't know if this is for me. I don't know, this is how this person is making me feel. We have a team of people that we will text in the text group saying, I feel this way. And our people are ride or die for us, literally. So, they will find us. If you're in a position where you feel like, oh, I need to find another job, guess what? Somebody in that group gonna be like, so-and-so got an opening. Or you say, I don't know how to deal with this. Somebody in that group is gonna say, after the ride or die moment, as she said, we're gonna all ride or die and go rah-rah. But somebody's gonna say, hey, this is how you need to handle this situation. And so find your team of people that you know, and your team does not always have to be in medicine. So your team can be your family. Your team can be those friends that you have that are going to support you no matter what. I have a team. Find your team, find your village, whatever it is, whoever it is, but the people that you know are going to support you and fight with you and ride with you and cry with you and all of those. We have that in each other and in our group. And you all, if you don't have it, you need to find one and make it.
The only thing that I'm gonna just add to this is that mental health is such an important part of it. Pre-med, shoot, even like getting out of bed and just functioning, and like we all had like traumas and bad breakups, had bad home situations, you know, girlfriend dumped you, cheated on you, all those different things. We all need that. And I think like what Dr. Tatum said, that like even though she is a physician, and I'm pretty sure she has a network of psychiatry friends that could help her, she still goes and sees a professional. Because that has that professional relationship, not your friend. I think your friends are a great support system, but sometimes certainly if your friend is an 18, 19-year-old just like you, they could be a support, but also they're probably going through the same things as you are. I'm on the mental health team or advisory board for my school, and a lot of schools, certainly community colleges, because of the pandemic, and they've received a lot of extra funding for mental health, and so there's things like better help and timely care and all of those things that our schools are paying for them, but there's like a less than 7% use of them. And these are like professionals, they're available 24/7. You could text them, you could Zoom them. I mean, that's pretty much the only way you could approach them. So it's really convenient. You could sit at home and do it at 11 o'clock at night. But you guys are not, people are not using it. And that's like, and if you run out of it, like I think like all of them have like you could use it like twice a month or something, but you could always go and ask for more. And they found those like online or those things, professional access to it. So there's a lot of resources that are out there, because mental health can be expensive, if you don't have good insurance or good health insurance or access to your school. And if you're a student and you're in school, though that's available to you and it's already paid for and it's very underused. And then the other part of it too, with the ACA, mental health is part of the ACA. So if you can't afford it, you could go through the ACA, and commonly known as Obamacare, that's a big component of it too. But absolutely use it, because if Dr. Tatum is using it, then we all should be like using it twice more. So
Now I would say also another resource, if you have a job and you have benefits, Employee Assistance Program. Let me tell you about that. EAP is a wonderful thing. They usually give you 8 sessions, but here's the key. You get 8 sessions per topic. And that applies for you and your family if you have a family, and you can use that. So 8 sessions per topic. So you can go in and talk about imposter syndrome and get 8 free sessions. Then you can go in and talk about depression and get 8 free sessions. You can go in and talk about test anxiety, because that's something didn't see it on the list, but that's something that people that look like us have a lot of. Test anxiety, that's 8 free sessions. So utilize all the resources that you have available to you, because again, mental health is very important. As I tell my trainees all the time, you can't take care of anybody if you don't take care of yourself.
I think that since we kind of like shifted to mental health, I have heard, and I'm kind of going into like the disability realm now, and the discrimination that comes with that. I have heard of a for lack of better words, fear, specifically for those who are like entering or currently applying or in medical school, of using the services that the school particularly is associated with, because of that documentation and of like if you have depression or anxiety and how that would, I know that it's not supposed to go nowhere, but if it, is used against you later.
No, I judge people who have issues and don't find help. I'm gonna be real. There are certain states that when you go apply for your license, they will ask you, the question is, I'm gonna tell you how the question is worded though. Have you ever had a mental health condition that has crippled your ability to do your job? By you going and getting help, that's preventing it from affecting your day-to-day duties. And so medical boards understand that. Medical schools understand that. Most programs now have an opt-out program where everybody has the resource available to them, and they will set up the appointment for you in advance. It is your choice to say no or not. So let's dispel that myth. Please go get that help. Please go talk to whoever you need to talk to in order to get that help, because that's important. Again, the question states that, is it crippling you from being able to do your job? And by getting help, you're not crippling yourself. So that is not true.
Yes, please get the help you need, because you want to be effective in whatever space you are in. And going back to what she's ended with earlier, if you're not healthy, you can't then provide help to other people.
Thank you for that. Yeah, that was just not a strong theme that I've heard, but a concern. It's especially for most folks specifically, I'm referring to the SNMA map space, that are like first gen, or their family doesn't see therapists, so they don't really know how to explore it and things of that nature. And so we kind of just absorb what we hear. And it can cause unnecessary like anxiety or fear around things, but also can be a legit concern for folks, and who may also be exploring like how to prevent that crippling of whatever mental health um, issue they're tackling. And I've also heard another reoccurring thing of like how to seek support if you have like ADHD in the medical school space. So what is that? Like not really knowing how to find like academic help, or how to even use the disability office, and like what to ask for. Like I think that most people think of like extended time, but that is all that really we talk about, is like just extended time. We don't know anything past that. But I know that there's more things that can be, offered to help students. And so I don't know, this is kind of outside of this what the purpose of this topic was, but if you all have anything to add to that or to help guide pre-med students on that, that would be great.
I would say utilize, hopefully if you have ADHD or any other condition that you're seeing a physician that's managing it and you're not trying to manage it yourself. That's number one. Utilize your physician that's caring for you or your therapist that's caring for you and ask them what resources do you need. Get them to put it in writing. You take it to your program, you take it to your school, you give it to them in writing. There's a whole thank you. There's a whole ADA policy that people cannot discriminate against you based on that. And if you give the school, similar to you teach high school, Logan, I taught special ed, similar to an IEP or a 504 plan. If those things are documented in writing, then that is something that your school has to accommodate. Now, I'm gonna tell you where the problem comes in. Your school can accommodate it all day, but when you get ready to go to take tests, like the NBME test, USMLE test, or anything like that, I'm just being real, they are really hard on giving you the accommodations that you need. And it may not be that they're not going to give it to you, but they're going to take so much time that it's going to delay you being able to get in. And so I need you all to know that that is a thing and that's real. It's going to take forever. It can go through, but it takes forever. But take that written documentation to your school for what, and ask, it's not your job to figure out what your accommodations are. It's your healthcare professional's job to do that and let them write down what you need and then give that to the school. And the school has to accommodate it. That's a law. If they don't, then you can get paid and get some money.
Yes.
Yeah, the only thing I would add is healthcare is the most regulated thing in this country. Second is education. And they're not doing it because they're being nice, it's because they're legally mandated. And if they don't do it, there's lawsuits and a whole bunch of headaches for institutions that they don't want to deal with it. I'm dyslexic, but because my language is English is my fourth language, you can't really test me for dyslexia, but I don't see words straight. And so I've had issues with a class, and I'm like, you just need to figure this out. Not my problem. That's a you problem, not a me problem. And you all need to figure it out. And that has to do with any other kind of disability. I've heard people that are like light sensitive and they needed to wear like sunglasses, and a professor went off on them in the middle of the class. Well, I could tell you that that professor didn't return to that class for a couple of weeks because you can't do that kind of stuff. So I think those are all like, I think being able to be advocating for yourself, but also getting professional help. Like if a doctor or therapist signs it, the school doesn't have to be nice about it. They have to oblige by it. It's not like oh, we just think you're such a great person. No, it's like a legal, they could be, legally liable. You get your education paid for, but that's all different.
I just saw a question in the Q&A, and it said, someone's on the process of preparing an application for medical schools and they identify as a person with disabilities that has been officially diagnosed. It's a key part of their identity and they're unsure of whether they should include this in their application at all. Should they disclose or just wait to receive an acceptance and contact disability services after you matriculate? I'm very wary of having these held against me, even if the institution says they did not discriminate. I get it. However, I'm going to tell you, I need you to go ahead and reveal that up front for two reasons. One, it allows them to be able to determine, do they have the services available for you? And you need to know that because not every institution has all services available. I don't know what your disability is, but not every institution has the supports needed to support everything. Number two, I say this a lot to my applicants of color. If it's somebody that's going to discriminate against you because of any part of your identity, that is not a program that you need to be at anyway. So let them know. If they discriminate against you because they don't want whatever your disability is, bye-bye to them, okay? Go on to the next one because you don't want to be there anyway. Even if you got there and you told them this is what's going on, then how are you going to be treated for those 4 years? Medical school is already hard enough. without you having on the additional, adding on the additional stress of being discriminated against for a piece of your identity that you can't change. So yeah.
Nothing to add. Beautifully said.
Yeah, if they're not with you, they're against you. And I don't want to get biblical on that, but that's what it is. I mean, it's.
I was thinking of a rap song, so it's hilarious that you said
Now you got to tell me
biblical.
which
Now you gotta
song,
tell us,
Logan.
Logan.
But
Which
the lyric
song?
is not appropriate. Maybe.
Oh,
Yeah, no. I don't even know who sings that or raps that song. But yeah, I'll Google it and let y'all know.
Yeah, no,
Probably uses one of the 4-letter words.
Yeah, no, I mean, this is something that's come up a couple of times about LGBTQ status and you know, and even like transgender. And I have a couple of friends that are transgender, and they're like, "Yep, we didn't apply to these schools and these places for sure because we didn't even bother." And even though they're really great places, like there's a list that you could get for through the MSPA, which is the Pride Medical Student Association. They have a grade for the schools, and some people just don't apply to those certain schools. Yeah, I think that's kind of I think it's a really important thing. But yeah,
Yeah, to kind of go
let
off.
Logan at the end of this rap that song for us. Just
Oh, I'm not gonna rap it, but I do remember. It's called "Win" by J Rock. The win, 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 win. That's all. No, nobody. Okay, all right.
I'm a little older than you, Logan. I'm sorry. I don't even know who J Rock is.
I don't
please,
know
But
who
you
he
can
is
you can
either,
send
but
me a
I
link
can
in
put
play
there.
the
the
song.
link in the chat.
Yeah. Look, I'm like, who?
Okay.
What? Can you tell me some Jay-Z,
That
some
was J Rock.
Wu-Tang,
Yeah.
yeah. No.
Jay-Z's like 50 some odd years old. He's not cool anymore.
What you trying to say,
I
Juven?
think it's still cool.
I think
He's
so
cool,
too.
but
His music is still cool.
Beyonce's cool, but Jay-Z, I don't know. He's too stiff. I like old Jay-Z. I like the 99 Problems Jay-Z, not the.
To go back to that question about like choosing a school, to build off of that, let's say that once you get into your school and there's some like issues that you see, how does one go about advocating for more programs that center diversity, equity, and inclusion, either like within their school or in conjunction with the outside organization, or what else, or other ways to bring like that support into their institution?
I think one of the early things is, as a trainee or a student, is to figure out the faculty, the staff, the people higher up on the chain who are also in support of some of the things you're trying to do. Because let's face it, you all are greater in number, but you also need their, I don't have a better word, power, in order to really get things moving. And so it's my hope and prayer that you, throughout your journey, you have identified people who fall into those slots in your life. But I think that's, for me, that's the first thing I could think of that I might undertake.
I'm gonna say something that's unpopular, but it's real. That's not your job. As a student, as a trainee, that's not your job. I understand so many students come to me and they're like, how do I start this program? How do I start that? You're not getting paid to do this. It's people that get paid to do stuff. Your job is to be a student. I need you to go and graduate so you can be the best physician. I need you to go to residency and focus on being the best internist, best OB, best pediatrician, best whatever it is that you want to do. I understand where y'all are coming from. I really do. But I need you to really know it's not your job. And here's the problem. If you, as the student, you go and you put forth this program You go and you make this happen, but you don't have the faculty support that Dr. Marugi was saying. As soon as you're gone, that program is gone too. And what did you do? What did you do? And I know it's not what y'all want to hear. I hear this all the time from my mentees. They get so mad when I tell them this, but it's the truth. That is not your job. Find the faculty member that is in support of supporting whatever group it is that you represent and say, hey, can you do this? Whether they do a safe space or a brave space that's off campus, or they start a program on campus, that's fine. But I'm going to say it one more time. That's not your job.
Yeah, I think that's something that that we need to hear as students, because I think that we try to go in, try to fix things, and the main focus, as the SNMA says, is your academics, is to get you to be the doctor first. And so trying to essentially carry that weight and the weight of everything else can be overwhelming. And just to throw SNMA in there, if there's an initiative you're passionate about, we're probably doing it. You also don't get paid through SNMA, but you get community and family, lifelong friends. So come check us out. I see that there's a question from the
But
chat.
hold up, Logan, you may not get paid for SNMA leadership, but guess what? That looks real good on your CV.
There you go.
So there's a benefit to that one. You get leadership in a national organization that a lot of people don't have. So you may not get paid, but that does help.
The question we have from Stephanie is, besides looking at the mission statement of medical schools, how can you tell that they are genuinely care about diversity?
Hopefully you'll get an interview, and those are the kind of deep questions you're going to ask them. How does it show up? What programming do they have? You're gonna just really ask those questions, because as Dr. Tatum continues to emphasize, you want to be at a program that's supportive of you and all your identities. And so it's going to be, while it's an interview and they're trying to understand you, you're also trying to understand them and the kind of place that you're going to be training in.
And I would add to that, look at their faculty, look at the pictures, see if their faculty are diverse, see if they mention it on their website. Y'all, there's still a lot of programs that mention absolutely nothing about justice, equity, diversity, or inclusion anywhere on their website. If you're in an interview and you have to ask about it and nobody mentions it, because most programs that's something that's a part of them, it's going to be in their overview. It's going to be all over the place. You're going to see it. If you don't see it at all, or you just see it in that one place, that's not real. Other thing is, when you have your interviews, talk to the current students that are there and ask them those questions. I was one that was like, look, I need you to be real with me. How do you feel supported? Don't tell me the interview answer. I want the truth. Because if I get there and you lied to me, then it's going to be me and you. But I really, talk to the students and ask them, how do they feel? How do they feel supported? And those are the big things I would say for that.
Dr. Tatum, I've heard you say or add like justice to the DEI. Can you explain that piece? What does the justice part mean to you?
That's one of my favorite things to talk about. Yes. So when you talk about equality, that means that you're giving everybody the exact same thing, which doesn't work. Because although I look at this screen, I see 3 Black women, we are completely different in our identities, who we are, what our journeys are, and what works for you, Logan, does not work for me, and vice versa. When you think about equity, it means that you're giving every individual what they need. And so we all have different needs in order to survive, in order to thrive, in order to be at our best. But when we talk about justice, we talk about removing all of the systemic and structural barriers that are in place anyway for any of us to, fail. And that is fairness. And that's why I talk about justice so much, because we have a broken system. Our country is broken, let's be real. Medicine is broken. And in order for us to make it fair for everyone, we have to remove those barriers that are in place.
Thank you for that. Up until tonight, I've usually just heard, the DEI piece and not the justice, which I think is an important component after hearing you explain it and how it correlates or connects with DEI, and shouldn't be a piece that is forgotten now that I know about it.
Yeah,
So
you got to
we are
remember, Logan, not all programs are quote unquote woke enough to know what justice is. I know because I study this. But not all programs have someone who studies in this area and is aware of what all of those things mean. So they may just tell you diversity, equity, and inclusion. If they don't include justice, don't count them out.
Okay. We are now going to move into our student or audience questions and answers. I know we kind of already answered some questions, but that's okay. If you all have any questions, please type them in the Q&A section of the Zoom box chat, and I will read them aloud so that our speakers can answer them. Until then, I'll just keep asking the questions I have. Sorry. So my next question, this kind of goes back to when we're talking about mental health, but now focusing more on like the emotional toll of experiencing racism and discrimination. Are there any strategies? I know we talked about getting a therapist, and that can be for sure one strategy, but are there any other strategies or techniques that pre-health students can use to cope with the emotional toll of that compounding experience of microaggressions or avert racism and discrimination? Whoever feels comfortable. I know I'm asking like these.
That's a hard one.
Like,
You're showing us hardballs. Like, I'm still dealing with it.
I was gonna say, I'm like, I am not the expert on how to deal with the emotional.
I'm still dealing with it.
I'm sorry.
I wish I had that answer. I wish I had the magic ball that would give all of us that answer. However, I don't think that is going to go away as long as we continue to experience these things. It is emotional. It is draining. It's exhausting. It's demoralizing. And I got a whole lot of words that I can say, but I have no answer for how to fix that because I'm still working on it myself.
Yeah. And I think we've talked about the ways we're working on it. So yeah, I think we need to recognize that. And if, as we talked extensively about, if you haven't started finding that help or finding your team, that's what you can proactively do. But yeah, still working through my stuff too.
Yes. And then one thing I forgot to say when you asked about, I don't even know if you asked it or I read it in the questions that you sent, Logan, but every school they are required to have what's called an ombudsperson.
Oh, yes, yes.
And an ombudsperson is the person that you go to report any issues of discrimination, harassment, bullying at all. It is their job to handle that through the school system. And so if you don't know who your school's ombudsperson is, find out who they are. You can report in different ways. They have ways that you can report anonymously. They also have ways that you can report and give them your name so that you can get follow-up information about what happened. And I can tell you that that ombudsperson is not, it's not like us. When I say us, I mean faculty. We have a job. We go to HR. HR's job is to protect the institution. The ombudsperson's job is to make sure that the student is protected. And so I need you all to be aware that that is there in any school system of higher education. So community colleges have ombudspersons, universities, medical schools. Y'all all should do Title IX training. And that's where that ombudsperson, that information will be.
Just to make sure I heard you correctly and to just emphasize it for our audience, the ombudsperson would be through the Title IX office, whatever, at your respective institution. Okay.
Yes, that is correct. And
Yeah,
I'm putting the name of it in the chat. So when you send out your stuff, if you wanna,
yeah, they call them either ombudsperson or Title IX coordinator. That's
Um,
another title that they have.
okay. I'm learning. Thank you.
Yeah, and then the other part of it too, but just be really careful. Those say that it's to protect them more than anything. So they have these like asinine rules that says you have to report within 5 days and you have to respond between 7 days, and just make sure you follow whatever they say in there. Um, their language is not really complicated, but there's a lot, so that if like you miss like one date or something, they could say, oh well, so just gotta be careful to advocate for yourself. But I know that all colleges have it. If they accept federal funds, they have to have it. It's not like they're being nice about it. It's like they legally have to do it.
Thank you so much for sharing that. I think these are the same questions that were in the chat. So I can continue to ask some of the questions that I have on my pre-prepared questions. Oh, so I know that you all discussed that still working like through and on the emotional toll of the discrimination that you face in the healthcare and academia spaces. So outside, how do I ask this? So outside of academia or like medicine, what are some things that help you like fill up your cup so that you feel better, returning to work and fighting the good fight?
well, I travel. My goal is to get as many stamps in my passport as possible. So that helps me to be able to come back. And then when I come back from wherever I went and I start to face and feel that emotional toll, I go in vacation mode in my head. And so at work now, when I am feeling stressed, people see me doing this. And they're like, what are you doing? I know. You're looking at me like, what? What are you doing? In my head, I'm like, beach, water, sand, sun. I smell the water and I got a coconut in my hand. Who can be mad with a coconut in their hand? So that's one of the things that I do. And I also I love good food. So I find places to go to get good, comforting food that makes me feel good. We already said, I know y'all can't tell, but I am an introvert. So I do like to reset by myself. And I spend time out. I take myself out on dates, do things like that. And that's how I reset. And I'm able to come back to work on some of those times when I'm like, I'm not going back to that place. I do because I have those. I know y'all getting all the real stuff today. Y'all probably shouldn't have invited both of us together, but you're getting all the real today.
And I think it's important. I don't think so. I always knew I was quieter and I prefer to read and be by myself. But I think it's important to understand yourself, because then I gave myself permission to say, in order to be my best Emma, I need to get the heck away from y'all. And so for me, it's taking that walk by myself, reading that book, putting on the noise canceling headphones, even if I'm in that very crazy house, because I knew that's important for me. And I get my sleep. If I could go back to college, I would have gotten all the sleep. I don't know why I thought pulling an all-nighter was going to help me pass the test, when all I needed to do was get that sleep so I would retain all the things I already had learned. So get your sleep.
Speaking of resetting through books, that connects great to a question that we have in the chat. Somebody said that they read Gifted Hands, and they would love to know or love to get some more book recommendations if you have any.
So in my free time, I read non-medical books. I'm just be real with y'all.
So
because
true. I was like, I haven't read a book about
I live medicine all day, every day. So I want to
Yeah.
read. I read true crime books. I read fiction books, but nothing that has to do with medicine. I'm sorry.
I'll think through it. Let me look at
Yeah,
my
I
Libby
can think
app.
of it and I can send you some,
Yeah.
Logan. Because I'm sure I have some. I'm looking over here at my bookshelf now. I'm sure some from my pre-med days that I was like, ooh, I'm so excited. But no, not today.
What do you all read for pleasure then? Some favorite titles or current favorite titles?
I'm looking at my Libby app right now. Y'all, I just finished reading Tomorrow and Tomorrow and Tomorrow. And I would have not picked up this book because it's about video gaming, but it was excellent. So I'm going to let you know that. Put it on your list.
You're muted, Logan. Oh, you were just repeating the title. I have been tapping into a lot of Black authors lately and reading books. It's not in here, it's in my kitchen. It's a book about from a chef, and he's talking about cooking and the history of different foods in America and where soul food really comes from. And it's been a really good read and it's been really interesting. So I got that. I've also been reading a lot of self-help books. So I read a book. Ooh, okay. So this is a book I recommend for y'all. It's called Permission to Feel. It is a really good book. And so often in medicine, we're told that we have to put ourselves second and put the patients first, and we can't feel this and we can't feel that. And this book allows you to tap into your own emotions and Permission to Feel. It is a really, really good book.
Is it by Mark Brackett? I don't want to tell folks the wrong book. And then Tomorrow, is that by Gabrielle Zabin?
Yes.
Even? Okay.
I've been on a James Baldwin kick, so.
And I do love that book, Juven. And yes, Permission to Feel is by Mark Brackett.
Lovely. Okay. For our audience, we've posted the names and links in the chat. And PreMedCC also has a list of books through Amazon, it looks like. So please get your read on, go check it out. Oh, looks like we have another question. Evelyn is asking, what are ways to study science books? So I guess like study tips to retain information, maybe. Evelyn, you can check, correct me if I'm wrong.
So if you mean how we study in pre-med or in medical school, for me, it was a lot of repetition. I needed to see, I'm that person that I have to see it in multiple different ways. So I had to read it, I had to write it. And so I would read it, I would write it out on my flashcards. A lot of times I would listen to things so that it would solidify in my head, and then I could go back to my flashcards. Some of those, first of all, you got to learn how to pronounce the words. Because there are still some of these words that I don't know how to pronounce in medicine, but you have to learn how to pronounce the words. So the first thing I would do is a basic medical terminology class that teaches you the understanding of some of these words, like you got to break stuff down to the basics. So if you have not, I would definitely do a medical terminology class, and that helps.
I mean, from what I'm observing, even from the medical students I work with now, the repetition is going to stand the test of time. I see them doing the online flashcards and that sort of thing. One of the things I wish I had done sooner when I was an undergrad was use the teacher. Like, they're less likely to give you a bad grade if they can see you working hard. So be at their office hours, get to know them, let them help you understand the concepts. And then once again, you all have tools that I didn't have in terms of YouTubes and YouTube, sorry, that sounded old, but YouTube instructors who can help you think through things. I'm not that old.
Oh, sorry.
Yeah, actually, it's really interesting. There's a lot of medical terminology YouTube videos,
Mhm.
and there's this guy. I'll put it in the link, but he like does like roots of words and then has like cartoons and connects them to the Latin. And I'm gonna look him up and put it in the chat. We also had somebody who spent about 2 hours talking about how to be successful in your science and STEM classes.
Mm.
And this dude is actually like he has a PhD in neuroscience, and he's like studied like retention, and he also like written a lot of stuff about the MCAT. So watch some of his videos. We've had him speak a few times, but I put one of his videos on there. But yeah, I mean, I think like learning how to study, and everybody learns differently. Like some people do it by like, for example, when I learn like math and physics and stuff, it's just by doing a lot of problems. It's just beating yourself up, and then also like connecting pictures to things. So everybody learns differently. But yeah, there's
Yeah.
space repetition. There is now also, the younger folks are using AI and study stuff, which I haven't like figured out how to do it, but the young folks are doing like AI stuff. So yeah, I don't know how that's done, but smarter people could probably explain it better than me.
So
There's
I
actually
might not be one of the smarter people you're talking about, but I'm gonna tell you what actually helped me out a lot. There are so many coloring books
Mhm.
on medicine and things like that that really solidify things for me, because I would remember it and I would see that picture in my head instead of seeing all the words get jumbled up. I would see the picture that I colored. And so, like, laughing your way through the boards, we have a book called that. And I found some of those when I was in medical school as well. And they really helped me. So finding things like that are awesome.
Somebody actually asked a question about similar kind of to that. But they asked, how do you draw pictures about the diagrams in science books like biology?
Talking about those concept
So maybe
maps.
a good alternative. It just says pictures from diagrams in science books. So
So a lot
Evelyn,
of
if you
my classmates used to use concept maps, and I could never do that. So
Mhm.
I may not be the one to answer that question,
I
because
could
I
never
don't
figure it
learn
out
from
either.
like people that do the word clouds and
Yes.
show how they all work together. Yeah, that does not work for me. So I may not be the one to ask that question. However, there are YouTube videos.
The YouTubes.
YouTube
to
can show
university.
you how to do concept maps.
Yeah, I just dropped the thing. We have this draw it, know it. I used it for my bio class, and it was really helpful. You watch a 10-minute video and then you draw through it, and you could get like a 20% discount. I dropped the thing in there. It's called Draw It, Know It. It's actually done by neuroscience professor from Washington University who founded this company. And you could like if you could get like 3 months free, so you don't have to pay for it.
Okay. Evelyn, I don't know what your next question is. I can't tell what that is.
It's a
So if
smiley
you can,
face.
oh, okay. My computer makes it look like a little, like, looks like a microbe, actually. Um, so hopefully that means we answered your question, Evelyn. If not, again, feel free to drop it again, in the Q&A.
And also drawing,
And
like one of the funnest classes I took at community college was how to draw. And
hmm,
I liked it. It was like a class that I could just go in there and sit there for an hour and a half and just doodle and draw and like totally disconnect from like reality. I liked it. It was a fun class.
yeah. I think that this is me taking my experience as a teacher from in high school, that there's a lot of work that I didn't realize that goes into making these lessons and things of that nature, and then getting prepared to essentially do a presentation for X amount of hours multiple times a day. And so going back to the thought of like, hey, go see your professor during office hours, it really does make a difference, because sometimes when people are like texting or they're emailing or they're doing whatever else but listening to the lecture, it feels like, I'm doing a lot of work and y'all not there's no attention, there's no, appreciation of this to help you learn, right? Because they already got their degrees. They done. I think that it shows, now I understand that it shows a different level of like the respect of their craft and what they're doing. And so I definitely, if I was back in undergrad, would do the same thing. I would go to those office hours a lot more religiously than I just like popping in like literally one time in the semester and thinking that would make a difference. So yeah, definitely use those office hours and speak to your professors, and even just mention the things that you found interesting, not just always the stuff that is you can of course go there for challenging things, but sometimes a lecture might be fine for you and there's nothing challenging, and you can still go there and say, hey, I found this really interesting, can you tell me more about it, da, 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 da. And I think that is a helpful way. And also it helps you if you're pre-med to, not that this is your you're not trying to what I'm trying to say, but it's helpful to you as a pre-med at the end when you try to get that letter of rec, if they actually know you, versus you showed up that one time in 4 months of the semester and think that they can write a good letter of recommendation.
That works for long term too. I went to medical school 7 years after I graduated from undergrad, and my professor still knew me when I had to go back to them to get letters of recommendation. So let yourself be known to people. And I did do some community college time to take my prereqs before I went to medical school. Some of my professors there wrote letters for me as well, but talk to them. But here's the other thing, don't go too far, because then you don't want to be labeled as a sucker. Yeah, we know, they call them what, gunners? We see them and we're like, oh goodness, here they come again. Don't go too far. Don't go overboard with it.
Be known but not annoying.
Right. I'm going to do another call from the audience. We have about 10 more minutes before we wrap up our webinar. If there's any burning questions, please ask. Even if it's not particularly about discrimination as the topic of the webinar, but maybe you have application questions. We have doctors on the line.
My question, I don't know if this was asked, but how did you deal with failure? Did that get asked? How do you deal with failure, like, ranging from not passing a test, doing bad on something, losing a patient, professional setbacks versus personal? How do you deal with that, and how do you overcome it?
So this is Tatum's whole thing. So I'm gonna talk first so that she can finish it. But I did not do well when I failed something in college. I was that person who was like, why me? And this was a math test. And it took me many years to reflect later on what the professor told me. But he said, Emma, there are tests in life that are going to matter, and this is not one of them. And so it was later on that I learned that he had recently been diagnosed with cancer. So that was a test result that mattered. My math test didn't matter, but I'm 19, pre-med. I'm like, oh my God, I can't get a C in this class. It's going to ruin everything. So I would say when I was younger, I did not do well. Obviously now I can reflect back and see what he meant. And you can look back at your life and you see every time you had a misstep, you learned more than when you just sailed through something. And the wisdom of prophets, blah, blah, blah. But anyway, I didn't do well when I was younger. Dr. Tatum can tell you her story, which I love hearing.
So my failure will probably ring a little bit closer to home for those of y'all trying to get into medicine. People think when you get into medical school, when your medical journey starts, that life stops, and it does not. And so I was in medical school. First of all, I was older. I told y'all I didn't go until 7 years after I graduated from undergrad. And there is something to be said about being an older student in medical school when you're trying to study and you're around all these little young people running around partying and stuff. And I thought that I could do a dual degree program, MD and MPH at the same time. And I had medical school classes during the day, MPH classes at night. Remember, I said life happens. So my grandmother died when I was in a neuroanatomy exam. That was in May. That was the week of Mother's Day. And then 3 months later in August, my mom had a stroke. She moved in with me while I was in school during the day and at night and coming home, taking care of my mom. And I'm a first of all, I'm a first gen college grad. I'm the youngest of all my siblings, but I'm the first one to graduate. And I'm the first gen physician on both sides of my family. And I felt a lot of pressure from my family and my mom in particular. And I was like, I'm gonna take a break so I can take care of you. They were all like, you can't take a break. You can't do that because then she was going to feel guilty. And then also they all felt like because when they took breaks, nobody went back, I wouldn't finish medical school. And so I had all of this pressure on me. I'm taking care of family and doing all of this. Finally, I ended up saying, which is why I'm really such a big supporter of getting mental health help. I was like, this is too much. And I almost got to that point where it was crippling me. And I went to my dean and I was like, I have to take a break. And he was like, I've been waiting for you. I already got the papers here ready for you. I was waiting for you to come to me. And so at the time, I took off like 3 months, which was nowhere near enough. And I went back. And when I went back, I went to go take step one. And Dr. Emma Marie is shaking her head because she's heard this multiple times. I took step one. I failed it by 2 points. 2. Really hard. I had horrible advice from the people who were there, and they said, only study the things that you didn't do well on, because clearly you know everything else. And you have to laugh at that now, because in hindsight, I don't even know why I believe that. I was a teacher before, and that made no sense to me, but y'all the experts, so I'm gonna listen to y'all. Don't always listen to the experts. I did what they said. Guess what, y'all? I failed it again. This time by 1 point. 1. They tried to tell me to leave medical school. They tried to tell me that I would never get into a residency program. They tried to tell me that I needed to find another career. And I was like, hold on, let me let y'all know something. This is my 3rd career. I was a high school special education teacher. I was a lab tech in the Army. I did all of this to get here. I'm going to finish. Y'all not going to help me. I'm going to find my own way to help. And so I did that. I started doing my research. I found a study program to help me do it. And I passed it. And for a long time, the people at medical school, they were still judging me, even though I passed it, even though I moved on. I even had someone in a position that I should have been able to trust, which is why I tell y'all, don't always trust the people that look like you. Asked me like 2 months after I passed, when are you going to pass the test? And I was like, I know you got the email that said I passed it. I passed it 2 months ago and I'm on my clinical rotations now, but that was a dig because this woman kept digging at me the whole time. Like even when I was about to graduate my chief year and go on to fellowship, she was like, I want y'all to meet Andrea Tatum. She's going to fellowship at this big name place. And I think it's amazing that she's done that because we didn't think she was going to make it. Right. So how did I overcome it? I think the better question is, have I overcome it? We have these conversations often, and I don't know if I really have overcome it sometimes, just being real with you. However, what I do is I use the position that I have now to be able to help other people. And I feel like sometimes, had I not gone through that, I wouldn't be where I am now, because part of my reputation is normalizing failure and helping students who are struggling and doing successful remediation programs. And how did I begin doing that? Because I did not get the support. Nobody supported me at that time in medicine. It wasn't until afterwards that I started meeting people like Dr. Omarui and Dr. Yamani and other people that looked like me that were like, don't let that hold you back. You can do this. And so when I tell you all, to build your circle with people that will support you and people that have your back. Like my friends who knew nothing about medicine at all. And they were like, girl, you got this. What we got to do? You know, they were there. They had my back. So I don't know if it's something you're ever really going to get over. However, what I've done is change my mindset. And instead of just calling it a failure, I call it a successful failure because I failed. But guess what? I got back up and I kept going. And instead of letting it hold me back, I used it to push me forward and to also bring other people up behind me. And again, I will say, if you never fail anything in medicine, like it may not be a big test like USMLE, it may not be the MCAT, it may not be your ITE scores, which is in training exams, which we take in residency, or anything like that. It may be that you missed a diagnosis. It may be that you knew you should have ordered a test, but you didn't. And then, you know, afterwards, you're like, man, I wish I had done that. But if you haven't failed at anything along on this journey, then you haven't tried hard enough. It is not easy. You are going to fail. You're going to. So if you think you're going to get through without failing anything, then you're wrong. If you want to go through without failing anything, then find another career because this one is not it. So failing successfully is what I've learned. And I've learned that it's not the fact that I fell, it's how I recovered. What did I learn from it? And how can I use that to help the next person? I hope that answered y'all question.
It did. Yes, hand clap. Thank you so much for sharing that. And for me, and I hope for the audience as well, it's been insightful. We have one more question before we head out, and it's from Evelyn. And Evelyn, if you want to provide some more information, you can, but you don't have to. But she says, my experience at my school has been discriminating from a couple professors and a dean in my college department. How can I find a solution to working around this moving forward? And that's all that's there. There's not like more information about like what the experience particularly is.
I think it's challenging without all the details, but I do want you to feel like you can maybe talk a little bit more offline if you're more comfortable with that, so we can speak to the nuance of your situation.
Yeah, Logan, you have my email address. You can share that with Evelyn. And Evelyn, you can email me. We can talk about it and figure out how to move through it.
Thank you. Oh, she says, please, I am open. Okay, I will share with Jubin and then he can get it to you, Evelyn, if that's okay, Jubin.
Yeah.
Okay. All right. Well, we have came down to the time where we are wrapping up. I would like to thank our speakers so much for being here tonight. We've gotten real and we've gotten a lot of information. But hey, we like it. We love it. Don't change.
They're not going to invite us again, friend.
No, I think
not what we said.
No, I think I really love the story that you shared just right now, and
Yeah.
it just
Powerful,
reminded
right?
me of Maya Angelou's poem "I Rise." You know, I mean, I think that's what ultimately I think that's, you know, nobody promises life to be easy, but it's you're supposed to have ups and downs, but it's just how you how you get up. But I don't know, I just reminded me of that poem, so. Yeah, thank you again for coming. Evelyn, if you could just just email me to this email and then I will forward it to them.
All right. I don't know how do y'all typically close out? Or do you just want me to go off script?
Just close it out.
Okay. All right. So thank you again to our speakers. For updates from PreMedCC or the Student National Medical Association, please follow us on Instagram. Do you all have an Instagram that y'all don't mind folks following you at?
You can follow me on Twitter, but I don't do Instagram.
You know, I got the YouTubes.
MySpace.
I'll put my Twitter handle. It's a handle, right? So I have to say my Twitter name. I'll put that in
Yeah,
the
it's
chat.
called a handle. I will also drop SNMAs as well as PreMedCC's IG. Now I can't think of the name of the handles in the chat, as well as our websites. You guys can keep updated about upcoming things there. And should anybody be interested, I think we're sold out, but the annual medical education conference is coming up, so please keep a lookout on our Instagram to see what that's all about, in case you're interested in attending next year. Thank
Where
you
is
so
it going to
much,
be
and
next
that's
year?
all I have for today.
Where is it
St.
going to be?
Louis. It's in St. Louis next year. St. Louis, Missouri.
I
So
don't
if any of
know.
y'all gonna
New
be at
Orleans is
AMEC
better
this
food.
year,
Huh?
I know. I was about to say, if any of y'all gonna be at AMEC this year, I'll be there. So make sure you come and say hi.
Yeah.
Well, working probably.
We have to beg Logan for some extra so we can buy more tickets.
Listen, I can try to pull what I can, but there's only so much pull that I have.
Good. Yeah, I love New Orleans. I love the jazz clubs and the blues clubs, and I've been 3 times, and I never go during Mardi Gras. I go like when it's quiet, but I love the music and the food. I go and gain about 10 pounds and come back.
That's what I'm scared of doing. But hey, you live.
Hey, YOLO. All right. Well, thank you again for making yourself available on a Friday evening. I know